The most common question that I get as a dentist is, how do I brush my kids' teeth? So I always tell them there are many ways of doing it. Firstly, obviously, you need to have the right toothbrush. There are many different types of toothbrushes in the market. We have at least 3 or 4 types. We have the manual toothbrush, we have a kids electric toothbrush that plays music, we have a half moon brush, one of those Jack and Jill stage 3 toothbrush. Sometimes we even have to use a finger brush, even on a 4-year-old. So it all depends on what they're happy with, what they're willing to use. The second thing is toothpaste. Some kids can get quite picky with toothpaste. Some don't like mint, some like strawberry flavored, some like tutti frutti, all different ones. And unfortunately for a lot of parents, it is trial and error. With my kids, they've been quite happy with flavors of the tooth mousse that I use to brush their teeth with. So try different ones. If they're happy with it, then you can stick to that one. For young kids, we generally recommend either a low fluoride toothpaste or even a tooth mousse instead of a toothpaste. A lot of parents that I speak to would be kneeling on the floor trying to brush their kids' teeth. I find that in that position, the kids can play up a lot more. They have room all around them to move backwards. And so it gets, it becomes a little bit of a chase, a bit of a game. So my preferred way is actually to lie them down on the floor or in their bed and approach it that way. So similar to in a dental chair, so coming from behind, that way it helps you to actually visualize every single tooth in your mouth all the way to the last molars. The other way you could do is, if you want to do it in the bathroom, you could come from behind. So approach from behind and then do it as if you're brushing your own teeth in that position. As they grow older, you can give them a little bit of independence. So for kids about kinder age, so 4-year-old kinder, so 4-year-old onwards, I would let them brush in the morning with supervision. The night brushing, I tend to let them brush their own teeth first, and then I'll go back in and do a check. And often I will just give a quick brush and just make sure that they've got especially all those molars and the surface next to the tongue as well. My kids are 3-4-year-old. It will work differently. Obviously, my kids, I've trained them from young, which is another thing that I would encourage parents to do. So right from a young age, do it properly and be consistent with it. Kids thrive with routine, so this is part of their nighttime, bedtime routine. So with a toothbrush, always aim at that junction between the teeth and the gum. So roughly pointing about 45 degrees towards the gum, and you want to go slow and always start in the same position. So you don't jump from left to right and then do a little bit of middle and then you've forgotten whether you've done left or right. So I always start on the right, on the top right. I am left-handed, so if you're right-handed, you might start on the opposite side. So I always start on the top right-hand side, all the way across on the what we call labial, so the cheek surface or the lip surface, all on the outside, and then go back on the inside, and then do the bottom exactly the same way. Last thing that we do is we brush the tongue as well. Often I let the kids do that. They know how to brush their own tongue because a lot of germs can stick onto the tongue, and that is a big surface as well for germs to hide in. After that, if you're using a fluoridated toothpaste, you would get your kid to spit their toothpaste out. There's actually no need to rinse it out, so just get them to spit it out. With tooth mousse, I'm okay with it. Either they can spit it out, or often my kids will just swallow them. The next thing is flossing. This is a big thing. Often parents don't floss as well, or they're not regular flossing. I make it a point to show my kids that I floss. There are flossettes that you can get as well that come in different shapes and different colors, bright colors that may attract their attention. So I give it to them and they play with this floss to start off with, but I always go in and I start flossing your teeth. So one way or one trick that I do often is, you have meat stuck in there. what's a meat gonna do at night? Maybe the germs will come out and have a feast in your mouth. You can use the flossette. For me, it's just easier, most likely cheaper, to just use a normal floss. It's quite simple, and you're aiming to go in between two teeth. So take note, especially with molars, your kids might be very, very lucky and have big gaps or gaps in between the front teeth. More often than not, with the back teeth, they are touching. So you want the floss to break that contact point. You want to go slightly underneath the gum, and you make sure that you're doing both surfaces. So you need to push it against one tooth, slide it up and down, and then the other side as well. So once that's done, they're ready for bed.